Dietitian to Dietitian, your one-stop shop for any questions you may have regarding your practice. I'm Maya Hirani.
And I'm Natalie Pogue.
Tonight we are reporting on the up-and-coming topic of nutritional epigenomics. First, let's start with some terms so that you're not confused. Epigenetics is the interaction between individual gene sequence variations and the environment. Nutrigenomics, the study of how diet turns genes on and off. Nutritional epigenomics, diet-induced changes to DNA that alters gene expressions. We will primarily be focusing on nutritional epigenomics through this session. DNA methylation is an important concept to understand before we really dive in as well. DNA methylation is the degree to which methyl groups are present or absent from certain regions of our genes. It is thought to be more stable than other epigenetic markers and plays an important role in regulation. Generally, hypomethylation allows a gene to be expressed. In contrast, hypermethylation interferes with the expression. Depending on the situation, hypo or hypermethylation can be beneficial or harmful. This depends which genes are affected, at what point in time they are affected, and in which tissues they are in. You may be wondering what the heck this has to do with dietetics in your practice. Well, DNA methylation is impacted by several nutrients such as folic acid, B2, B6, B12, and methionine, since all of these play an important role in generating methyl groups through one-carbon metabolism reactions. Let's take it to Crystal to hear about epigenetics.
Thanks, Maya. I'm Crystal Becker. First, I'm going to be talking a bit about how the environment and early life experiences can have an influence on genetics. Epigenetics mediates the influence of the environment on the existing genome. One such environmental factor is early life stress. In clinical studies, early life stress, such as the experience of child abuse or neglect, have been shown to be a strong predictor of impaired regulation of the HPA axis. The HPA axis, or the hypothalamic pituitary adrenal axis, is a stress response system that is core to the long-term regulation of stress. So, its dysregulation can lead to a long-lasting altered stress responsivity during adulthood and may also predispose individuals to psychiatric diseases such as depression. Early life abuse and trauma can also affect gene expression. Studies done on rats have found that exposing the rats to early maltreatment can produce lasting changes in the DNA methylation of certain genes and can alter those genes' expression. This altered methylation was also observed in the offspring of females who had experienced the maltreatment. What this all suggests is that there are epigenetic mechanisms potentially underlying lifelong changes in gene expression, and dysfunction in the epigenetic programming could later result in disease. There may even be transgenerational consequences to these mechanisms. Over time, these subtle changes may lead to a greater vulnerability to stress and increase the risk for disease. This is all mediated by epigenetic mechanisms. Now we're going to take it back to Natalie to hear some more.
Thank you, Crystal. Now to elaborate on that. In 1992, researchers laid the groundwork for the fetal basis of adult disease hypothesis, or as we like to call it, FEBAD. This hypothesis stated that because organs undergo developmental programming in utero that predetermines physiological and metabolic adaptation during adult life, nutritional deprivation or environmental exposures that disturbed developmental programming could lead to a higher risk of disease in adulthood by permanently reprogramming the functional capacity of organs. Classic examples of this include increased risk of adult-onset cardiovascular disease, type 2 diabetes, osteoporosis, depression, and certain cancers. Studies in adults have demonstrated epigenetic changes related to environmental exposure to metals, air pollution, benzene, and persistent organic pollutants.
Thanks, Natalie and Crystal. Now that we have an idea about how epigenetics impacts the health of our patients, let's discuss nutritional epigenomics and how it all began. Research done on the Dutch famine's impact on the children that were in utero at the time is what really started this entire idea. Studies show the long-term effects of decreased nutrient supply to the fetus during all 3 trimesters. Independent of the stage of fetal development, prenatal undernourishment resulted in decreased glucose intolerance in adults aged 50 to 58. There was also a significant increase in the BMI in the female offspring during this time. The studies also found significant decrease in DNA methylation of insulin-like growth factor 2, which is associated with schizophrenia and coronary heart disease. Folic acid supplementation is implemented nearly all over the world at a recommended 0.4 milligrams per day to help decrease the risk of neural tube defects in the fetus. There are several foods nowadays that are fortified with folic acid to help mothers that are unaware that they're pregnant during the early stages of their pregnancy. Although this may sound perfect, it can actually lead to over-supplementation without the mother being aware of it. High folic acid of 5 milligrams per day, as we said the recommended was 0.4 milligrams per day. At 5 milligrams per day, it's only shown to be beneficial during the first trimester of life. After trimester 1, it actually has negative impacts due to the increased methylation of insulin-like growth factor 2 in children, which, as we talked about before, leads to an increased risk of chronic diseases. Also shown in mothers that have a high folic acid intake but a low B12 intake shows higher rates of insulin resistance, increased body fat percentage, and increased abdominal fat at 6 years of age, this leading to type 2 diabetes in the children. This is important to keep in mind with our patients because folic acid supplementation might be good in the beginning, however it may be unnecessary and even harmful in the later stages. Let's see what other macro and micronutrients impact the health of our patients.
Thank you, Maya. That's very interesting. So I'm going to start off by talking about calories in pregnancy, then I'm going to go into saturated fats, and then later on I'll start to talk about protein, the big one. So as for calories and pregnancy, a low caloric diet of a mother can actually increase her infant's risk of getting type 2 diabetes and hypertension later on in their adult life. Maternal obesity can restrict development of the placenta, which can alter how the developing fetus is protected from stress hormones, and inhibit the delivery of serotonin, BDNF, and leptin, which all play an important role in the development of the fetal brain. Now, for saturated fats. A diet of high saturated fats of the mother during pregnancy can actually increase her infant's risk of having insulin resistance leading to diabetes, and also increases the infant's risk of getting obesity and hypertension later on in adult life. Maternal high-fat diet reduced DNA methylation in some genes. In many studies it was found. Now, as for protein, offspring of protein-restricted diets have an increased risk of hypertension, dyslipidemia, vascular dysfunction, decreased immunity, and increased susceptibility to oxidative stress. Restriction of protein during pregnancy or lactation also impacts the expression of specific genes in lipid homeostasis. Now, what about the micros? Let's talk to Crystal about them.
Thanks, Natalie and Maya. Relating to chromium, which is involved in glucose and fat metabolism, maternal restriction of chromium during gestation resulted in increased body adiposity in the offspring of rats. Additionally, studies on rats have found that moderate maternal zinc restriction during gestation resulted in an increase in body weight of the offspring compared with offspring of mothers who consume normal levels of zinc. So you may be wondering how this impacts the field of dietetics. Nutritional genomics is becoming a new bridge between nutrition and health. In recent years, epigenetics has become an emerging issue in a broad range of diseases such as type 2 diabetes, obesity, inflammation, and neurocognitive disorders. Dietary factors can elicit different epigenetic mechanisms in early critical developmental stages, which can affect the susceptibility to several diseases in adulthood. For instance, studies suggest that maternal and neonatal diet may have long-lasting effects in the development of non-communicable chronic adulthood diseases, particularly the components of the metabolic syndrome such as insulin resistance, type 2 diabetes, obesity, hypertension, and cardiovascular disease. And the outlook for this field is very positive. Based on a survey commissioned by the International Food Information Council in 2005, more than 2/3 of Americans surveyed expressed a favorable opinion toward the idea of using genetic information to develop personalized nutrition recommendations.
Okay, now to implement all of that into our field, we need to make some changes. First, we need to incorporate the practice of nutritional epigenomic health assessments and counseling by all practitioners. We also need to change the way the DRAs are designed to make sure that it helps everyone. We also need to develop a new diagnostic test to assess status and measure efficacy of nutrition prescriptions. And last but not least, we also need to expand the food for health products, or as we like to call them, functional foods, marketed to individuals with nutritional epigenomic biomarker profiles.
Thanks, Natalie. Although all of those changes would be great, some problems will still exist. First of all, people will still get sick, and people will still be non-adherent and have resistance to change their behaviors, even when we try to incorporate our behavior change theories that Dr. Tucker taught us in class.
That's a really good point, Maya.
Still, there is potential for misguidance and fake advice given by companies that are trying to sell products to consumers. The field of nutritional epigenomics is growing, and we encourage you to do your research if you are interested in incorporating it into your practice. But for now, thank you for joining us, and we hope to see you next time on Dietitian to Dietitian.
Alright, ready? That is so interesting. I practice. Well, B2, B6 lead to a greater organic pollutants. No. Oh. Adequate. In zinc, studies on